Hi, my name is Peyton Atkins. Today I'm going to be trying to persuade you as to why pain medication prescribed by your doctor is not always the safest alternative or the safest way to solve your problem. Have you or someone you've known ever been affected by addictive drugs prescribed by doctors? Drugs like oxycodone, codeine, Xanax are all drugs commonly abused by American citizens, yet they are legal. America's opioid epidemic has ruined lives and tore families apart. These addicts are created by our own medical system, and they are often criminalized and shunned by our own justice system and left to fend for themselves, often resorting to illegal drug use. So first, how the use of opioids in our medical system can ruin lives. In America, about 80% of people who use heroin first misused prescription opioids. It's an alarming fact when you hear it, right? On top of this, heroin is a Schedule I drug in many parts of America, meaning if you're caught with it, you're more than likely to serve time in jail. The opioid epidemic started with doctors overprescribing opioids like oxycodone to patients in need of pain relief. These patients often had no idea what kind of adverse addiction effects these opioid drugs had on the mind and the body. Many people understand that they have a problem with these drugs and they seek help from their doctors, but their doctors are legally obligated to cut their patient off of the drug if they're suspected of abusing the drug. Opioid drugs cause horrible withdrawal symptoms that only get better with time and physical help. 72 hours after the last opioid dose, addicts will experience chills, fever, vomiting, diarrhea, muscle pains, and insomnia. The physical pain will start to lessen, but the emotional pain is still very real. Often addicts withdrawing will feel depression, cravings for opioids, and trouble sleeping for months after their last opioid dose. These withdrawals often cause the patient to buy into using illegal street drugs to find their fix. Buying opioid pills at a marked up price or even heroin can turn these craving addicts into a completely different person. Now, the addicts aren't to blame for their addiction. The way our judicial system works, these people that truly need help are often shunned by the system and punished for an addiction that they did not cause. Often addicts that resort to street drugs are deemed criminals and the blame rests on their shoulders. We must change the way we think when it comes to preventing addiction and helping these addicts. First, to help the addicts, we must consider what has worked in the past. Switzerland had their own opioid epidemic in the early 2000s, and nearly 1% of their population was addicted to heroin. They tried punishing the addicts the same way our judicial system works today, and they tried putting them in jail, but this never worked. After examining the situation, many high-ranking scientists decided to legalize heroin, and they opened clinics for addicts to come and seek treatment and resort to a safer alternative, as in not street drugs. Just to clarify, you couldn't buy these drugs from your local drugstore, like your local CVS or Rite Aid. It was only available in the clinics. Switzerland saw a massive drop in crime rates, and their opioid epidemic came to an end. In this situation, blaming the one who is addicted will not work. Only in working to better the lives of these unlucky individuals we will see progress and hopefully rid America of its opioid epidemic. The reason America is in the opioid epidemic we have today is because of negligent overprescribing by doctors and patients that don't know better. Patients that are seeking help for chronic pain need a better option other than a drug that is incredibly addictive. Having more pain specialists, people who are educated on pain relief and know what will stop pain per capita will only help chronic pain sufferers. Stopping the use of opioids for people that have not been exposed to them is very important. If we rid out the use of opioid drugs, then the amount of users will slowly decrease for years to come. That's why it's important to turn down opioid medication prescribed by your doctor. Stopping doctors from overprescribing medication and having more medical professionals dedicated to bettering the lives of addicts is the only way to stop our current opioid epidemic. Make sure before your doctor hands you a bottle of pills, you know the side effects and remember what can happen if used negligently. Thank you.